Good morning to you. We're all in our places with sun shining faces. Is this not the way to start a new day? Today, folks, we're going to talk about a very important topic, which is cosmetic surgery. And without further ado, may we now call on stage Dr. Mejia to teach us about this new trend. Let us all give a round of applause. Ayan, so, good morning, Dr. Mejia.
Good morning. Good morning, Erica Bantiga, and to all our viewers today. I will talk about first about cosmetic surgery. Today, it's very trendy. It's now famous in all of our, we can see in our actresses, actors, models, and other rich people that could afford it. I will talk to you about cosmetic surgery in a way that the principles, techniques, and basically the center point or the essence of cosmetic surgery is enhancing the patient's appearance. So the key area of cosmetic surgery is to enhance appeal or improve the client's appeal, symmetry, and proposition. It can be done on the face, the neck, and the body.
Wow, Dr. Mejia, you look very experienced. So, yeah, if I would ask, in your 15 years of being a cosmetic surgeon, how many patients have you had in the past years?
I've actually had one patient so far.
Okay, one patient for 15 years. Yeah. Okay, so one patient.
Yes, one patient because, well, not actually one, more like 1/4, 1/2, because I've never really, performed surgery for her.
Oh, really? You haven't for 15 years you haven't done any surgery?
A surgeon for 15 years, cosmetic surgeon, I've never really performed the surgery.
Okay, and if I were to ask Dr. Mejia, pardon me,
Okay.
why don't you ever perform your profession in this in this country?
I don't really have a choice. After I graduated on the May.
You even graduated cum laude, right?
Yes.
Yeah.
Thank you for that wonderful.
Yeah. So
Yeah.
why haven't you performed your profession?
Because sadly, after I graduated, I've become legally blind.
Oh,
Yeah.
okay. So you're blind.
Yes, I'm blind.
Okay. So
Excuse me for a moment.
okay, so you're blind. Okay, so moving on. If you haven't performed the surgery to this client, who performed the surgery?
Oh, actually, we have our very own cosmetic surgeon named Regina Koizumi, who's actually with us today. She performed the surgery, which I would have performed for my client if I wasn't blind, you know.
Oh, okay. So can we call on stage Dr. Regina Koizumi, a Japanese cosmetic surgeon, together with her interpreter, Dane Platt. Okay, thank you. So, good morning, Doc Regina.
Ohayou gozaimasu. Good morning, Erica.
Oh, okay. So, is it true that your client was referred to you, Dr. Koizumi, because she wants to look like a Japanese?
はい、自慢じゃないですけど。Yes, that's true.
Okay, so Doc Regina, basically you were the one who performed the surgery with the client, and do you think you've done your best and performed well? Can we see this client? Can we see this client?
はい。皆さん、彼女がエネアサントさんです。
Wow, so let us call on Wow. You have a lot of fans in here. Okay. Okay. Okay, that's enough. Quiet, please. Quiet. Okay, thank you. So, you're really a beautiful lady, Enea. And, can you please introduce Dr. Koizumi Enea Santos and what you've done to her face or what you have improved to her body?
Can you show the こちらがエネアサントスさんの前の写真です。
So this is Nea Santos, and these are the pictures of the before and after appearance or the physical appearance of the patient.
Oh my god!
私がやったのは目を変えて口も変えました。
As you can see, we have done some changes in her eyes, and you can see that her lips are better now.
Wow, you're actually a good surgeon from what I'm hearing right now. I chose you very well.
ありがとうございます。Thank you.
Okay, so going back to you, Enea. Okay, so Enea Santos. How are you feeling right now?
Yeah, actually, I'm feeling great.
Oh, I can see that you're very happy with your appearance. I mean, like, can you stand up, please?
Yes.
Wow, I like the eyes. How you change your eyes?
Wait, let me answer a question.
Okay. Well,
It's pretty obvious. I'm actually feeling great and satisfied right now with my look. Though I've experienced a mild post-surgery infection wherein my lips became inflamed. Thank you.
wow. So that is a mild infection. So this is after the surgery. I see. So, So, is it possible, doc, that there really will be complications and risk in this cosmetic surgery?
Yes, there are a lot of possibilities where there's risk for infections, like this, whatever the picture looks like. Because after the surgery, everyone has the instructions from the surgeon to continue to take care of her skin. If a patient doesn't comply with all these instructions, it could lead to those. Also, cosmetic surgery is a lot of cons. There's also that it could go to excessive bleeding, and
I see.
you could have blood clotting also if the surgeon isn't very good. But for our cases, Miss Regina here is very good.
Oh, so it's only a mild infection.
Yes, after post-surgery, you have that kind of mild infection. It's pretty normal.
Oh, okay. So, going back to you, Enea, because I want to know you more. So, this surgery is actually a life-changing procedure, right?
Yes. Right.
So, what pushed you or made you decide to undergo this operation?
Well, honestly, I felt very insecure with other girls before.
I see.
And I felt being like isolated with a lot of people in the crowd and like that. So
Actually, we saw a footage of you before. A friend of you, yeah, a friend of you
my God.
sent something when
Okay.
you were like, before the operation.
okay, let me see.
So let me see this footage.
yeah, that was my friend who is to me.
Oh, I
back then.
see. Oh.
So you were bullied when you were a child?
What?
You were
Pardon?
bullied when you were a child?
Yeah, I was really bullied when I was a child. Like, I don't want to leave. I came to the point where I want societal, but I trust myself enough to tell myself that in the future I can be beautiful, confidently with a heart.
Okay, so Dr. Tiffany, is it possible that there are different effects to the client? Like, will she be confident after the surgery, or will she be less confident?
Yes, Erica, there's actually two different reactions with this type of surgery. Since cosmetic, as I've said earlier before, it enhances the physical appearance of our clients. So basically, the two different reactions is that she could feel confident, as she said. She could feel confident. It could boost her self-esteem and all that.
Self-esteem.
Yes. But then the second reaction would be the negative one, wherein you lose confidence more in yourself because the result wasn't what you were expecting.
Okay, so do you think, Dr. Kuizumi, that Enea is very satisfied with her look right now?
はい。だってご覧の通り目と口と体が良くなっていても。
Yes, that's true. And as you can see, Inea has actually boost her self-confidence, and there were times that she was really depressed, but right now she goes to work every day, and she's really contented with how she looks.
Yeah, because you've already achieved the Japanese look before, the eyes, and the nose and the lips. I see. So, to wrap it up, guys, to wrap up this talk show, we all know that cosmetic surgery has its own pros and cons. And different people have also their different stories or reasons as to why they undergo this procedure, just like Inea Santos. But this procedure does not really create a societal beauty standard in which people will judge you on what you do when you undergo this procedure, because actually cosmetic surgery enriches one's physical aspect by being beautiful, and being beautiful means being confident. And if that's the way that Enea will be confident in her own skin, well then I think that cosmetic surgery will be really very helpful in this country. So once again, this is Erica Mandiga, and see you on my next episode. Thank you.